Welcome, everyone. My name is Anand Nayak. I am a professor of medicine and public health at the University of Texas and the Michael E. DeBakey VA Medical Center in Houston. This is a training for patient priorities care. There are 3 modules to this training. At this point, you should have completed the first, which is an overview or description of what PPC is and why it is needed. This is part 2 of the second module, and it is designed to prepare you and your patients to identify health priorities. It can be done either with a facilitator who is a member of the healthcare team, or the patient can do it as a self-directed process with or without a caregiver. This training today will prepare you to serve in the role of a PPC facilitator. There are 5 main steps to help identify patient priorities. We previously described the first 2 steps, identifying what matters most to the patient and translating those values into specific, realistic, and actionable health goals. Next, step 3 involved reviewing the patient's symptoms and health problems. Step 4 focuses on reviewing the patient's healthcare tasks and medications. Finally, step 5 helps narrow down this information to identify the one thing the patient most wants to focus on in their healthcare to achieve their goal. These 5 steps are in the service of identifying the patient's priorities. In a nutshell, patient's priorities are the health outcome goals that the patient most wants and the healthcare that they're willing and able to do to achieve those goals. In terms of who we do this process with, it may include not only the patient, but may also include caregivers, family members, or others who are important to the patient. In terms of the where this is done, it can be flexible. It can occur in the clinic, at an in-home visit, via telehealth, or the patient can do this on his or her own time at home using the self-directed website. We will now walk you through steps 3 through 5 of this process. After creating a specific and realistic goal that the patient can achieve, we then work with the patient to identify what health systems and conditions might be interfering with her ability to pursue her goal and live according to what matters most. For example, in the case of Mrs. B, you might say to her, "Mrs. B, of all of your symptoms and health problems, which are the most bothersome and you think most interfere with your goal to watch your grandchildren after school 2 to 3 times a week?" To get a full picture of the patient's health care and what matters most to the patient, we must understand how the patient feels about her healthcare tasks and medications. You may want to help the patient find a balance between the health goal she desires and the healthcare task the patient is willing and able to do to achieve this goal. This balance is the patient's health priorities. We want to help patients find a balance between the goals they desire and the healthcare tasks they're willing and able to do to achieve those goals. This means identifying their healthcare preferences. To do that, we need to identify what is helpful care and what they're willing to keep doing. But we also need to know what is burdensome in their healthcare, what they find bothersome, and/or what is interfering with their healthcare goals. For Mrs. B, this may explore the issues around fatigue and why she finds a CPAP burdensome. Healthcare preferences really involve both of these domains, helpful care and burdensome care, with the expectation that we will be trying to avoid, as much as possible, some of the burdensome care. Helpful care is all the aspects of healthcare that are helping patients meet their goals and what they are willing and able to do. To explore this, you might ask, what do you like best about the way you and your healthcare team are managing your conditions? What about your healthcare do you find useful and helpful to you? What's working well? Patients vary in their preferences. One patient may be viewing taking a diuretic as burdensome, whereas another might say, even though it makes me urinate more frequently, I don't mind taking it because I get less short of breath and that helps me stay active. On the flip side, we discuss what is burdensome about the patient's care. These are the things that are too difficult, uncomfortable, or time-consuming for the patient to continue doing. Essentially, the patient doesn't want to be doing them and may not be doing them because they're so burdensome. It's therefore important to give patients an opportunity and permission to voice the things that they find burdensome. For example, you might ask, are there tasks you are doing for your health that you'd like to stop doing or doing less of? Which of your tasks are taking the most of your time? Does this time feel worth it to you? If you could change one thing about your healthcare, what would it be? A patient might say, I really don't mind coming into clinic, but I don't like coming every week. I get exhausted by the end of the day, and I'm missing out on a coffee group that with my friends. I wouldn't mind coming once a month. Another response could be, well, there's this new blood pressure medication that the cardiologist put me on. Well, it's making me dizzy and tired, and to be honest, I'm not taking it. It is important to give the patient space to say what is bothersome about their care. We would like to better understand why something is either viewed as helpful or burdensome. It might be helpful to use questions as prompts for discussing helpful or burdensome care. For example, you may ask, what parts of your healthcare are you able to do that help you to meet your goals? To understand if something is bothersome, you might ask, what about your healthcare is too difficult or uncomfortable to do on a regular basis? The concept of trade-offs brings it all together. Trade-offs are the difficult choices that patients have to make about which treatments are worth the discomfort or burden because they may help them reach their health goals. Trade-offs involve balancing the benefits and burdens of healthcare tasks. For example, a patient may ask, I find it burdensome to take blood pressure medication because it makes me dizzy. At the same time, I understand it prevents a serious illness down the road. Together, the patient and clinician explore whether a recommended treatment helps the patient meet his or her goals at a level of effort that the patient is willing and able to make. We recommend working through some examples of trade-offs with your patient. It is useful to ask patients specifically what they find burdensome about each aspect of their care, including medications, self-care tasks, at-home tasks, tests, treatments, procedures, and healthcare visits. In the example of Mrs. B, when asked what she finds burdensome, she states that she doesn't like using her CPAP. In fact, after some prompting, she admits that she doesn't use it most nights. As she gets more comfortable with her clinicians, she also reveals that she doesn't like taking many medications and really wants to avoid going into the hospital. These are the preferences that can be documented in the electronic health record, and the clinician can use this information to discuss trade-offs with the patient. Patients may initially be hesitant to comment on what is not going well. It's important to create a safe space for the patient to feel comfortable to say, well, actually this treatment has been a bit more taxing or time-consuming than I expected. Some examples for opening this conversation include, it would be great if you could reach your health goals without treatments or lifestyle changes that are hard or uncomfortable. Unfortunately, that's not always possible. Also, sometimes you have to make difficult choices about which treatments are worth the discomfort or burden. These difficult choices are called trade-offs. For example, the clinician may say to Mrs. B, Mrs. B, if you're willing to wear your CPAP, even though it may be annoying, it could improve your energy and allow you to do things you want to do. This approach identifies a why, or a treatment rationale, that the patient can connect with. The patient can judge for him or herself if the burden is worth it, in terms of how well it's getting them to their goal. It is useful to conclude the health priorities identification discussion by arriving at the one thing. First, the one thing gives the patient an opportunity to state which thing they most want to focus on now. This is similar to the chief complaint in the traditional medical history. Second, the one thing provides a clear place for the clinician to focus treatment planning on. To arrive at the one thing, we ask the patient, what is the one thing you most want to focus on in your healthcare? This can be a burdensome or problematic healthcare task, such as the frequency or dose of a particular medication, or it can be a symptom, such as I want to be less tired, I want to be less dizzy. It's also important to tie the one thing back to the patient goal that is being impacted. So with the one thing, you can say, there is something getting in the way, a symptom or a problem. The reason that it is important to address this symptom or problem is because it is getting in the way of a meaningful goal. For Mrs. B, the one thing is, I want to be less tired so that I can continue to watch my grandchildren. Here we have an example of an electronic medical record template completed for Mrs. B. We've outlined how she reaches the one thing by first identifying what matters most to her and her most important health goals, which are watching her grandchildren after school 2 to 3 times a week and volunteering in the library. Her healthcare preferences, which are the things that she's able and willing to do, and the things she finds difficult or taxing. From this, we know she is willing to go to the physical therapist and finds omeprazole helpful for reflux. She finds it bothersome to take multiple medications daily, take a diuretic, use a CPAP machine, and be in the hospital. Her most bothersome symptoms are fatigue and hand pain. And for her one thing is that she wants to focus on being less tired so she can continue to watch her grandchildren. This template captures the key information about patients' priorities and can be used by clinicians to align care with what matters most. This summary of health priorities is generated after working through the My Health Priorities process on the self-directed website. Patients can write their own summary, print out the summary, and take it to their next appointment. This will help the patient communicate his or her priorities to the clinician. Using this summary may activate the patient and encourage a better partnership between the patient and clinicians. We suggest the following pointers when working with patients. Encourage patients to be proactive in discussing priorities with their clinicians, and in some cases with their family members and other caregivers. Encourage the patient to ask questions, especially when they don't know the answer or don't understand something. Be proactive, be honest, and do not be embarrassed to share. In fact, not sharing can actually lead to unwanted treatments or burdens that don't support patients' goals. Recognize that there are often barriers to patients sharing this information with clinicians. For example, sometimes patients are embarrassed, perhaps by a symptom or side effect, or because they're not doing a treatment that's been recommended, or because they're not making progress towards a goal that is important to them. Also, patients may be reluctant to voice priorities due to deference to healthcare professionals. Remind patients that healthcare professionals do want to know their priorities, and knowing priorities will in fact help them to make treatment decisions. Consider a patient's health literacy in these conversations. Patients may not understand some medical concepts, what a medication is supposed to do, or how to take it. Patients may feel the doctor's too busy. He or she just doesn't have time to talk about this. I don't want to waste their time. We've heard that a lot, and we say, what is more important than talking about your priorities? If you have time for nothing else, it's time for you to voice your priorities and talk about what's getting in the way of achieving your priorities. Keep in mind that priorities may change over time depending on changes in the life or health of a patient. If that does happen, priorities can be revisited. You may ask, don't worry, I know your priorities may change, and we can check in regularly about them. Knowing what matters to you allows the healthcare team to do what is best for you at any time. We will work together to identify what matters most to you over time. Here is a summary of resources available to support facilitation of patient priorities care. In addition to the current training, an online course is available through the American College of Physicians called Helping Your Patients Identify Their Health Priorities. There is an annotated health priorities template, which gives quick tips on questions to ask the patient for each section of the template. At the myhealthpriorities.org website, there is a self-directed process that allows patients and family members to walk themselves through the 5 steps we have just discussed.